Ebola virus disease (EVD) is a severe and often fatal illness caused by the Ebola virus. It is known for causing a high mortality rate and can lead to outbreaks with significant public health implications. The disease primarily affects humans and non-human primates such as monkeys, chimpanzees, and gorillas. Causes and transmission: Ebola is caused by one of several Ebola viruses, which belong to the Phylogiridae family. The 5 known Ebola virus species are Zaire Ebola virus, EBOV Sudan Ebola virus, SUDB type forest Ebola virus, TJFV Bundibugyo Ebola virus, EDBV Rescan Ebola virus, RESTRB. Note: this species has caused illness in non-human primates but not in humans. Transmission: direct contact. The virus is transmitted through direct contact with the blood, bodily fluids, or tissues of infected individuals or animals. Contact with contaminated materials, contact with contaminated surfaces, bedding, or clothing can also spread the virus. Infected animals. Ebola virus can be transmitted from animals to humans through handling or consuming bush meat. Wild animals hunted for food, especially if the animal is infected. Human-to-human transmission occurs through direct contact with bodily fluids of infected individuals, including vomit, feces, urine, and semen. Healthcare settings. The virus can spread in healthcare settings where proper infection control measures are not followed, particularly in the handling of patients and their fluids. Symptoms of Ebola typically appear 2 to 21 days after exposure to the virus, with an average incubation period of 8 to 10 days. Symptoms can include fever. High fever is often one of the first signs. Severe headache, intense and persistent headaches. Muscle pain, generalized muscle pain and weakness. Fatigue, extreme tiredness and weakness. Gastrointestinal symptoms, nausea, vomiting, diarrhea, and abdominal pain. Skin rash. Rash may develop in some cases. Bleeding, internal and external bleeding, including bleeding from gums, eyes, and rectum, and sometimes bleeding from the nose. Other symptoms: red eyes, sore throat, chest pain, and difficulty breathing. Diagnosis. Diagnosing Ebola virus disease involves several steps. Clinical evaluation, assessment of symptoms and recent travel or exposure history. Laboratory tests, blood tests to detect Ebola virus proteins, RNA, or antibodies. These tests are typically conducted in specialized laboratories due to the infectious nature of the virus. Polymerase chain reaction (PCR) detects viral RNA. Enzyme-linked immunosorbent assay (ELISA) detects Ebola virus proteins or antibodies. Virus isolation, culturing the virus from samples, though this is less commonly used due to biosecurity concerns. Imaging studies. In some cases, imaging studies like X-rays or CT scans may be used to assess organ involvement and complications. Treatment and management. There is no specific cure for Ebola virus disease, but supportive care is critical for managing symptoms and improving survival chances. Treatment includes supportive care, hydration, ensuring adequate fluid intake to prevent dehydration, electrolyte replacement, maintaining electrolyte balance, pain and fever management, using medications to control pain and fever, nutritional support, providing adequate nutrition to support recovery, experimental treatments, antiviral drugs. Medications like remdesivir and favipiravir have shown promise in clinical trials. Monoclonal antibodies. Treatments like ZMapp and Ebanga have been used in some cases. Convalescent plasma. Plasma from survivors may be used to provide antibodies to current patients. Preventive measures. Vaccination. The RSV-EBOV vaccine has been shown to be effective in preventing Ebola virus infection and is used in outbreak settings. Infection control. Strict infection control measures, including the use of personal protective equipment (PPE) and isolation protocols, are essential in healthcare settings and during outbreaks. Public health measures. Measures such as safe burial practices, Avoiding contact with infected individuals, and public awareness campaigns can help prevent the spread of the virus. Prevention and control. Personal protection. Use of PPE, including gloves, masks, and gowns, especially for healthcare workers. Hygiene. Regular hand washing and use of alcohol-based hand sanitizers. Safe burial practices. Handling of deceased individuals with care, using protective equipment, and following safe burial practices. Community education. Educating communities about Ebola symptoms, transmission, and prevention measures. When to seek medical attention if experiencing symptoms. If you have symptoms of Ebola and have been in an area affected by Ebola or have had contact with someone who has Ebola. If you are a healthcare worker, in case of exposure to suspected or confirmed Ebola cases. Conclusion. Ebola virus disease is a serious and potentially deadly illness that requires prompt medical attention and rigorous infection control measures. Although there is no specific cure, supportive care and experimental treatments can improve outcomes. Preventing transmission through vaccination, public health measures, and safe practices is crucial for controlling outbreaks and protecting communities.